All right, thank you everyone for joining us. Welcome, welcome. It is such an honor to have you with us today for our second webinar with the Department of Community Health and Social Medicine at the University of Global Health Equity. So get comfortable. We're excited to have a really interesting and dynamic conversation on research and advocacy. My name is Zahira, and I'm an assistant professor here at UGHE, and also the Godly St. Gore Chair of the Department of Community Health and Social Medicine. And as I said, we're delighted and excited that you could join us for this conversation and spend your time with us, both for this episode, but also for this one-year webinar series. Today's episode is entitled Activism and Advocacy, Photovoice and the Science of Storytelling. This session is part of this year-long skill-building webinar series, where we hope to encourage all of us to take away new tools for the work that we are doing in community-based activities. Our goal in each conversation is for each of us to do just that, and to find ways to apply this creativity in our own community-based work. And sometimes, like today, we're going to talk about research and practice, but then on other days, we're going to talk about community organizing, other aspects of advocacy. And so we hope that you are excited to be in the second episode of what is this year-long exciting journey on community-based approaches to research, to teaching, to advocacy, and otherwise. Today's webinar will be a deep dive into the concept of Photovoice. So I'm excited to introduce to you in a moment two of our guests, but I wanted to share with you a little bit about what Photovoice is, and then our guests will build upon that. So Photovoice is a participatory action research approach that really focuses on developing research questions and answering them through photography and other imagery that is controlled and led by community members, and highlights challenges that need to be addressed by policymakers, practitioners, and others. So really an opportunity to use photography, storytelling towards change. Photovoice projects have been instrumental in gathering powerful information that might not otherwise be visible to those who need to hear it. And so we're really excited to learn more about this approach from our two guests. And you're gonna enjoy their conversations, particularly around their focus on youth in Uganda and youth in South Africa. So I wanna take a moment to introduce our guests before they jump into the conversation. So we are joined by Dr. David Musoki, who is a lecturer at the Department of Disease Control and Environmental Health at Makerere University in Uganda. David has been involved in research on various subjects in these domains, and he uses Photovoice in research with young people and with community health workers. David is co-chair of the Community Health Workers Thematic Working Group at Health Systems Global. He's secretary of the International Federation of Environmental Health Africa Group and chair of the Africa Academy for Environmental Health. David is also a senior visiting fellow at Nottingham Trent University in UK. And so I hope you will join me in welcoming David to the conversation. We're also joined by Dr. Avivit Charrington. And Dr. Avivit is a South African educational psychologist with expertise in community development and a research interest in transformative social change. So we're in the right place today. She's a program coordinator for a bachelor's in education honors program at Stadio Higher Education, a research associate with Nelson Mandela University, and the chairperson of the Community and Social Psychology Division of the Psychology Society of South Africa. And I believe we may have some folks in the participation group who are from this society. Avi has facilitated workshops and published several works on participatory visual methodologies. And so we are excited to have her and Dr. David. Please join me in welcoming them both. So before we jump into the conversation, we want to do a little bit of housekeeping. I know we're in this virtual world that doesn't feel as connected as it could be, but we're gonna try and be as engaging and dynamic as we can. And we're gonna ask you to please do the same. Please put your questions in the Q&A. Do it as we're moving through the conversation, as soon as a question comes to mind, because that'll help us manage how best to move through this dynamic conversation. So keep those questions coming. Know that we're recording and that you'll have this recording emailed to you once we are complete. All right. So the last thing I'll say before we jump into the conversation is just a little bit of, I would say, a map of today's conversation. We will be talking in 3 sections. And the first section is really just about what is Photovoice and how does David and how does Avi use it in their work. The second session is really about how you get into the implementing, kind of how do you learn how to do this? It's not nearly as easy as it sounds. And then the third item or the third section we'll be doing is really focused on positionality as a researcher, and then what dissemination and change looks like in this work. So I hope you feeling excited, and we are so delighted to have you again. Welcome, Murakaza Neza. I will begin with the first question for Dr. David. So David, we've learned a lot about the work that you've talked about in leading up to this webinar. And it would be great if you could describe for us what is Photovoice and why do you use it?
Thank you very much, Zahira. And I also take the chance to welcome all participants to this webinar. Briefly talk about what Photovoice is. Photovoice, I would say, is a community-based participatory research methodology that uses photography as a key instrument in the research process. And photographs taken from Photovoice studies normally help to facilitate discussion and storytelling as part of the study. But more importantly, the Photovoice photographs also help in dissemination, as we'll hear later. But this dissemination beyond other methodologies actually helps to lead to social and community change. And we shall also get a few examples of how, for example, photos from our earlier studies have actually led to change. So really, this is quite an exciting methodology. And I should also emphasize that one of the key attributes of Photovoice is that it really places the participants at the center and in the driver's seat regarding direction of the studies, as opposed to sometimes other traditional methodologies that have the researchers pretty much driving every aspect of the process, and therefore participants being a bit dormant. So Photovoice really ensures participants are active, and indeed they lead the process, as we'll get to learn as we go along.
Excellent. Thank you so much, David, for that introduction of what is Photovoice and why we use it. And I'd like to hand over to Dr. Avi. You know, in thinking about this kind of work, sometimes we get asked the question, essentially, what kinds of studies are Photovoice most relevant for? And so I'm hoping you can build off of David's comment and give us that level of specificity.
Right, so hi everyone, and thank you, Zahira, very much for the warm welcome. And hello to everybody watching and listening. Right, so there's 2 key motivations when you're thinking about Photovoice in your research. And the first one is the type of data that you're wanting to generate. And the second one is your research design and the purpose of your study. So if we look at the first one, the type of data, with Photovoice, what you're looking at is the lived experiences, the daily realities of your participants. And the key here is that you're wanting to generate data which is 100% from the worldview and the perspective of your participants. And you're specifically looking not just at how they experience a certain event, but you're wanting to see the emotional, the contextual, the relational, the cultural influences behind that experience. And so if that is the kind of data that you're looking for, Photovoice is a good choice. Another type of data that this is really good for in community work is when language is an issue, or there are cultural barriers. Or if you're looking, for myself as a psychologist, sometimes you want to work with concepts that are very abstract. It's very difficult for people to talk about how they experience it. Photovoice helps you to show how something's experienced within a context. So the second motivation is, what type of research do you want to do and what is the purpose? Photovoice, very much like David said, is interwoven with empowerment and ownership. it's not just about generating meaningful, insightful data about an experience, but in working with your participants, you're also mindful about the ownership and the participation aspect of it. And often when you're using Photovoice, you're wanting your research or your study or engagement to link in with some social change agenda, or what we call transformative research. And the idea here is that, as you will see as we talk more about it, that Photovoice is conducted in steps and stages. It's not getting into the field, give people cameras, they take photos and they come back. That's a misconception. There's a lot of work that goes up into doing Photovoice authentically and getting the meaningful data. And so you need to have the kind of study where you know you've got the time to really engage with your participants in the field, in the build up of it. It's all about the planning, it's all about the thinking, it's all about the talking about it, then the photographs, and then again the coming together. And so if you're not able to really invest the time, the patience, the relational aspect, then Photovoice is not the ideal method for you. Yeah.
Excellent. Thank you both so much for getting us started in this first section with what is Photovoice and what kind of studies are most valuable or most relevant for this approach. And thank you for highlighting particularly the time. I think if I remember correctly, when you and I spoke, that you may have spent 18 months in this work, working with young people. And I know in a moment you'll describe the study in more detail. And we here at UGHE are trying to encourage and discuss that level of depth when it comes to research and data collection and relationship building. So thank you so much for highlighting that, the time and the investment. So thank you both. This is a remarkable start. We know that you've each conducted participatory projects that use Photovoice, but also other forms of creativity, both with young people in Uganda and young people in South Africa. So this is where we want to hear about that work and jump right in. And for those of you with questions, please keep them coming as we move through the process. And so it would be lovely to hear if you can talk us through the study that you want to focus on today. And tell us a little bit about the project. What was the research question? What were you doing? And we will start with David and then meet Avi.
Thank you very much, Zahira. So I'll describe briefly one of our Photovoice studies that was on maternal health among youth in rural Uganda. And the aim of this study was really to explore how youth can contribute towards maternal health in their communities. And the motivation for this is that, as you would expect in our developing country populations, youth really constitute a big number of us, whereas their involvement in some of the critical public health issues, including maternal health, has not necessarily been that high. So we wanted to explore, given this high critical mass of youth, how could they in one way or another play a role in contributing to maternal health in their communities? So we went about this by meeting up with the local leaders in these communities to introduce the project to them, and working closely with the community mobilizers, they helped us to identify 10 youth, 5 males and 5 females. And these youth were trained by the research team to be able to carry on with the Photovoice task as required. And the training, as many of you would expect, included, of course, training them on general research principles, but also training them on the focus and theme of the study, which was maternal health in the broader context. But beyond that, we needed to train them regarding use of photography in research, which many times is a new concept to research participants. And we also had to emphasize the issue of ethics in photography. And I should tell you that using photography in research, is not that straightforward. The issues of ethics normally come in strongly. So we had to make sure that our trainings had a very strong component of ethics, including how to approach our participants for them to take photographs, how photographs are used before and after the study and during the study, what permissions do we need to get, and all issues concerning that. After the training, we were able to also have a session on camera use and taking care of cameras. And I must tell you, some of the participants were holding digital cameras for the first time. So we had to really spend time, training them on exactly how to take photographs, how to look after the cameras. And thereafter, we gave them the task of taking photographs in their communities concerning the theme or the interest of the study, which they did over a 5-month period. And during the course of the 5 months, we held routine monthly meetings whereby the research team came to the communities and we met the 10 research participants and 2 members of the research team. And these meetings were mainly to have the participants show us the photographs they had taken during the course of the previous month, but also to be able to elicit discussion around the theme of the study. And just to emphasize that the photographs taken by individuals were not only talked about by the individual photographers, but other participants were also able to chip in, really making it enjoyable, but also learning from each other and really building a very strong data, if you like, that was later analyzed to be able to generate the data from the study. And of course, on completion of the 5 months, we had dissemination in various forms, including community dissemination, including publication, conferences, and seminars, and we'll talk about some of these later on. So that's really an overview of this particular study that we conducted on maternal health among youth in rural Uganda.
Excellent. Thank you, Dr. David. And I know that is a short time to share such a deep dive into work that you've done over many years in Uganda. So thank you for being able to describe it in that way. And for the audience, keep your questions coming and we will get deeper and deeper into each project. So thank you for that presentation. Dr. Avi, I'll ask you the same question. Tell us a little bit about your project, the research question, how you used Photovoice and what it all meant.
Right, so my study looked at exploring rural South African children's conceptualization of hope. At the time, I was a community psychologist and I was working for a very large faith-based organization in South Africa. So I would regularly visit various communities and work with the children's centers and the non-government organizations in designing programs. Right, so my interest was really in psychosocial support. There were a lot of orphans and vulnerable children in the community. And as a community psychologist, I was always looking at how do I strengthen the community support systems that would then assist in uplifting and providing services for the children. And I was struggling to find much research that really centered the Afrocentric or the African worldview in terms of children's development, in terms of psychological constructs. And I was very interested in hope. And so that is what I decided to start looking at is in terms of how do we shape and foster and build hope when we're looking at working in rural traditional communities in this country. So I connected with one of the aftercare centers that I had already started working with. They were located in a rural community and the center was called St. Kizito's Children's Program. They offered various services to the children. The aim of the study, I had 2 aims for the study. The first one was the academic or theoretical aim, and that was really to explore the children's conceptualizations and experiences of hope and hopefulness. And I wanted to really use this to challenge existing very Eurocentric models and theories that were so prevalent at the time so that we could move away from looking at hope and well-being as simply a success achievement oriented virtue and rather move towards the relational communal aspect of it. The second aim was really the methodological one, to look at what are the practical applications. And I was using participatory visual methodology. So this is where the transformative research as change comes in, where I thought, now, how do I use this research as sustainable intervention? And so as I was doing the research, the second aim was to look at how could I transfer the process of doing research with the children to explore their hope to become an intervention program that the center could then in future use as well. So I started working with the staff first. While I was still busy with my proposal phase, I engaged a lot with the staff. We brainstormed, we workshopped, they gave me some ideas, I kind of fed back to them. So a lot of that was already starting the engagement. They identified the children. They were just basically tasked with, I need to engage with 12 children. They selected them. And interestingly, one of the criteria they decided on was that these children were not doing well. They needed hope and they needed intervention. So that was basically why these 12 children were selected. I visited the center 4 times over a period of a year, specifically for the data generation phases. And each time I was there for a week or just over a week, and out of that week, 3 days were spent on data generation. But I used multiple visual methods. There was drawings, there was collages, there was clay modeling, and then Photovoice was one of those sessions. To run you through briefly, just the different steps so you can understand in your mind the process. So we did Photovoice over 3 days. On the first day, the children individually had to brainstorm lists of what makes you hopeful, or what is your source of hope and your challenge to hope. They were then chose to be in groups of 3. And in that group, they discussed their lists and they prioritized which ones are the most important. The next step was how do images create stories? So we did a whole little workshop and activity on how you can take pictures and how pictures can tell a story. And this is where a lot of the ethics of the visual come into play. And right at the end then, afternoon, they actually got their cameras. So there was 1 digital camera per group of 3. And we did some training. We showed them how to frame it, which you can see in the picture, how one of the guys is standing in a little frame. And they're practicing, and they did a practice run on what makes you happy about school holidays and what makes you not happy about school holidays. So it was a good run through in that afternoon. The second day, we repeated the process, but now we were looking at the actual research prompt, which was sources of hope and challenges to hope. Some pictures they had to stage, which means they actually posed in the center. Others, they needed to go out into the field. For instance, they wanted a police station or the clinic. Then they came back to the center, they printed out their own images, they selected their own images, they printed them out, and then they created posters of these images. And then the third day, everybody discussed, we shared ideas, and then we did the participant analysis. So they actually then selected out everyone's stories, the 3 key themes for sources and challenges of hope. That was basically where it was, and that's what was developed is a framework of how these children experience hope in a rural community.
Thank you both so very much. Excellent descriptions. As I said, I know it's hard to cram all of your work into just a few minutes, but I see the questions rolling in. So thank you for that, everyone. We will be addressing those. Sometimes you'll see the answer to the question as you're moving through, but we will be addressing them in the last 30 minutes of the session. So keep them coming. Just so you know, we also will, any questions that don't get answered today because of the time limit will be answered by email to everyone who's registered for the webinar. So thank you for all of your engagement, and thank you, Dr. David and Dr. Avi, thus far for this presentation. I think what you shared so far, as I was thinking about both of your projects, one, focusing on young people, but 2, focusing on young people for things that people and researchers don't normally think of them for, right? So hope and young people in South Africa, and maternal health and young people in Uganda, and finding a way to bridge things that we're working on that are important to young people, but they may not normally be the center of the conversation or the center of the problem identification and the solution. So thank you for highlighting some of that work and for the diversity in visual methods. I think highlighting Photovoice, but also other ways that this creativity happens. So excellent. And work in the description, and please keep the questions coming. So we're entering our second section of this conversation, and we have just about 25 more minutes where we're presenting to you, and then we jump into your questions, and so excited for that. But one of the components that obviously is the most interesting and kind of dynamic about Photovoice are the photographs, right, that make it different from other research approaches. But more importantly, or perhaps equally important, are the facilitated conversations that happen around the photographs that bring out the findings and bring out the potential solutions. And so I'm hoping that Dr. Avi, you could tell us about one example of content that arose from the photography and from the facilitated conversations, and what happened and what did it all mean?
Right, so the thing to remember with Photovoice and most visual methods is because you're accessing people's lived experiences, when you follow the process well, it goes deep very, very quickly, and people want to share things about their experiences, positive and negative. And even though you go into a community and you're understanding already that there are issues, that's why you're there. Something like Photovoice allows you to come with a very general umbrella kind of interest and curiosity, and allow the participants themselves to bring the very difficult or controversial or contentious issues, rather than you going in there saying, these are the problems, I want to see how you experience it. And that really occurred in my study, where I knew I was going into a community that I'd already worked with for several months. I knew the problems, I knew the issues, and that's why I was there. But to see how the children presented it was really so significant to me, and to understand, how do you support children, and what are their understanding of their world? So I thought, instead of sharing the specific themes and contents, what really stood out to me, one instance here, is really how the children went about planning, staging, and thinking and representing, more so than what they represented. And one key thing that came up was the presentation of violence. Obviously, one challenge to their hope was violence in all its forms. It was very, very prevalent in their lives. Domestic violence, punishment received at schools, bullying, fighting, rape, and other criminal activities were consistently demonstrated throughout. So I want to share two examples of what happened. And bear in mind, this was my very first time ever doing Photovoice and doing research like this. It was very disturbing to see how these children were going about recreating violent scenes, which they were very adamant they wanted to include. The one was 3 boys who wanted to talk about bullying that occurred at school and how it took away their hope. They began staging a fight scene, and one little boy was crouched down on the floor with a camera framing his scene, and the other 2 boys were posing and, with their fists up and all of that. But this little chap down at the bottom was taking his job very, very seriously, and he starts yelling at them that he wants action, he wants motion, he wants them to physically do the movements. And so they start fighting, and with every blow and lift and throw down, it started to become a little bit more and more less play, more serious. And this little guy was really taking his time. He wanted to get the perfect shot. And I'm standing there observing everyone and not really knowing, just take the damn photo, right? And just watching everybody's faces of how they're watching the scene unfold. The other example at the top of the picture there is a group of girls who wanted to enact a rape scene. And I observe from the side again to see what they're doing. And the one girl is sitting spread-eagled over the other girl, trying to pose, but there was just way too much giggling going on and it just wasn't working. They took some photos, they were looking at their cameras, they weren't happy with it. So they called one of the adult care workers. Throughout my work, I also had the staff, the caregivers facilitating and translating and just being there. There was huge discussion going on, and the staff member calls one of the young guys, a youth, who was my technical advisor. And he comes across, they explain the whole thing to him. He's a 17-year-old boy. No problem. They get ready and off he goes, and he starts posing, and the action continued. There was no issues. The adult caregiver is watching, giving instructions. He's playing his part, he's playing his role. And it seemed to me, everybody was very excited and I was absolutely horrified. And so, Photovoice is a complex method. And for me personally, it was very much a balancing act as a psychologist, looking at the well-being and the trauma that was happening as a woman, seeing what was going on. It was really jarring to see the young children enacting some of these photos, staging some scenes. And even though you go into a community, or you go in with your participants and you get to know them, and you're going to see these things, it's hard to be prepared when the images do start coming out and when your participants do actually share their stories and share the narratives. Like I said before, it goes very deeply, very fast, and you have to be prepared for those kind of conversations. So that was my sharing.
Thank you so much, Avi, for that, and for the honesty about your own experience. in potentially in helping to facilitate, but also about what the young people and the folks who work in that location were expressing about what they wanted to convey to an audience. So I really appreciate the level of honesty and the thought that for many of us on the call, as we think about this kind of research, that I think sometimes we oversimplify it in our minds around it's photography, it's expressive. There may even be, lots of joy and fun in that because it's a new activity for whomever you're engaging with on your work. And yet, as Avi mentioned, sort of the speed at which something can get very serious, very deep, very specific, and your readiness as a researcher for engaging in that way. And obviously, Avi is a psychologist, but in some of our work, we may not be, and yet we need to be ready and have other folks who can support that, whether psychologists, therapists, social workers, and others. And so thinking about our work, particularly in qualitative work, in Photovoice, having those other forms of support for whatever ends up arising out of the data collection experience. So thank you so much for that level of depth. The next question we have as we move through this journey is for Dr. David. And we really want to, Avi has described one experience within the data collection, and you have done, my understanding, 2 Photovoice studies with community health workers and with youth. And today you've talked about that project with youth. And I'm wondering if you can describe for us 2 lessons learned that you think we should all keep in mind as we embark on this kind of research.
Thank you very much, Zahira. I wish we had time for me to describe 5, if not more, lessons. But just to pick on a couple of lessons for me, the first one I wish to hint in this discussion is that whereas sometimes Photovoice sounds all interesting and worth exploring, we must all know that actually it involves technology, including, of course, cameras or mobile phones or whatever devices that are going to be used. So if anyone is planning a Photovoice study, you need to have this at the back of your mind regarding technology, but also logistics that come along with the technology. I mean, being cameras or mobile devices, there's always the need for you to adequately train the people on how to use the cameras and take care of them. But also you should have in mind that something can go wrong. As an example, in our Photovoice study being described, one of the participants took the camera with her to a function in Kampala, the capital city, only for it to be stolen while she was there. So when we came to meet them during a monthly meeting, she was all in tears, having lost the camera, and she didn't know, she couldn't, of course, afford to have it replaced, and she just didn't know what she would do and how she would explain to us how that camera can be replaced. So we need to have that at the back of our minds. But also in terms of logistics, in our Photovoice studies, we have been having participants meet routinely, and then the photographs from the cameras are transferred to a laptop, and then the photographs are projected on a screen. In some instances, the power was cut off, and therefore we could not necessarily use the projector. So in the photograph that just came on, the previous photograph actually was a photo of us while in the field when power had been cut off, and we had to converge around a laptop to be able to discuss photographs. It's not the easiest thing to converge, 10, 12 people around a laptop, but we were forced to do so, given that, we couldn't, of course, use a projector. Imagine if we didn't have a good battery on our laptop, probably would have not had that meeting anyway. The second point I want to reflect on briefly is one thing I've learned over the years is that when you embark on a Photovoice study, you need to really be open-minded and a bit flexible, but also have at the back of your mind that you may be a researcher, but with the cameras, with the participants, they're actually driving the process. And we learned from our study that given the cameras are in hands of the participants, they play an instrumental role in shaping the direction of the study. So while as researchers in our conceptualization of the study, our interest was a lot to do with how youth were going to physically support maternal health, be it health-seeking, behavior, or supporting, pregnant women. But actually photographs came up from the participants that although, okay, the focus is on maternal health, there are other broader issues in our communities that also concern maternal health, but also general health. So in this photograph, for example, is of two children collecting water from a water source that the community or the participants really brought out strongly that yes, whereas the focus could be maternal health at the broader sense, we also have issues concerning water and sanitation and nutrition, which all in one way or another also affect maternal health. So really having an open mind and being open to letting the participants drive the agenda is really critical. And for information, with that openness in our approach of this particular study, we got much more data than we had asked for, which even led to more research outputs. We even have, a publication simply because we let the participants and we also let the agenda drive and be driven by them to explore other issues beyond what we thought was primarily the aim. So this is really another key lesson I'm happy to share. And again, many more lessons that I'll be happy to talk about later on.
Excellent. Thank you so much. Thank you both for sharing a little bit about what you've learned in this work. I think Avi talking about sort of that deep dive into the work and the surprises and the discomfort that may come for you as the researcher or for the participants. And David highlighting all of the practical things we need to be thinking about and the preparedness that's so important for all research, but particularly for Photovoice. And then thank you, David, for ending on that issue around humility that I think is really important in the research space, is that can we, with our research hats, perhaps even remove that for a moment and follow the leadership of communities, and even be willing, as you might have described, or I think you described, to shift what we're doing as the participants shift, because they're leading the journey as that moves towards answers and solutions. So thank you all for that. Keep those questions coming in the chat. There are some really great ones, so I'm excited to jump into that in just about the next 12 minutes or so. So we're entering what is our final part of the session, or the final part of the conversation, with two more questions for Avi and David. And this part of the session is about dissemination. It's about outcomes of research. It's about who you are as the researcher and the position that you take. And so we really wanted to give the listeners an opportunity to hear from Avi and David, particularly around the issue of positionality. And so in the work that you both described, it appears that you're not a member of the communities in which you're partnering with. And you can talk about that to whatever extent is helpful. And we're hoping that you can tell us a little bit about your own identity and how that influenced the work, and what you do about your identity and its influence on the work. So sharing a little bit about positionality. And we'll start with David, and then Avi, you can just jump right in.
Thank you so much, Zahira. So that's an important aspect of Photovoice, probably any other research anyway. But one thing is for sure, these communities that we worked in are certainly not ones that I come from. So one thing we made clear was that all activities concerning the process in the community was led by members of the community themselves. So issues concerning selecting, participants and, where we used to meet, and issues concerning anything regarding what happened in the community, we had to make sure that this is entirely left to the community members. But also in terms of the research process itself, although as a researcher, we developed the broader research questions, if you like, we really ensured that the process is driven by the participants. But also during our monthly meetings, as that photograph suggests, when we used to discuss the photographs taken by participants, one key thing we ensured was that our role was more to facilitate and moderate and offer, guidance and direction in terms of what they did, as opposed to us participants or us researchers really pushing participants in terms of what we wanted to hear from them. And that we felt was really important, because it really, left the participants feeling that it was indeed them in the driver's seat, as opposed to me, a researcher, actually, being the one to dictate left and right. And I'll give an example. I'm supporting a number of colleagues doing Photovoice studies, and one of them recently gave me some feedback that they were in a group discussion, and this person was wondering why a certain category of photographs they thought would come through was not coming through. And my answer to him was that maybe it's not that important to them anyway. So, you know, the researcher was trying to drive, you know, their interest and their agenda in terms of what should come out of the photographs, as opposed to letting the participants really take lead and let things come out the way they feel they should. So that for me is something that we have done. But I think the critical thing is to really ensure that as a researcher, although you have your interests and you have the pre-developed aims, it's important to step aside and really let the participants drive the process and not like chip in to direct and offer some guidance along the way.
Excellent. Thanks so much, David, for those reflections on community leadership. And maybe handing over to Avi on this same question of positionality, sort of how your identity plays a role, influences the work, and what you do about that.
So I think, you know, like David said, in all qualitative research, you know, I always get students asking, but how do you stay objective? But I don't want to stay objective. That's the point of qualitative research. I'm very aware that I'm part and parcel of this research, and the participants are creating and constructing because I'm there, right? So I don't want to avoid that. And so it is very much about positioning myself as being there and knowing that I'm a white female, educated city girl in a space where I'm a complete outsider. I don't have any experience or knowledge of the space that I'm in. So I go in there, like David said, with absolute humanness and willingness to learn. That's what I was there for. I was not there to do research. The research was sort of priority number 4 on the list. So I wore many hats at the time. Yes, it was my doctoral study, which I had to keep an eye on because there's certain formalities and things you need to do. But I was also there as the community psychologist with the purpose of understanding that community so that I could help them to design programs that would be sustainable. So it was very important for me as both the researcher and the psychologist to let go of the power. I needed the community themselves to take ownership of the knowledge that was being co-constructed. It was not my knowledge. I was simply engaging and stimulating and throwing questions and bringing in resources. And by the end of the day, we were all, immersed in this together. But I was very clear from the beginning, consistently, this is your knowledge, this is your community, these are your strengths, these are your assets. And I did that on various levels. I was obviously always mindful and reflexive. I had a field journal that I consistently noted everything in. I also debriefed and reflected. I had a supervisor for my research at university, who was also a psychologist, and I had a supervisor for my work. My manager was also a psychologist, so I had 2 sort of pronged approaches there. And in terms of the power dynamic, which is very, very important, is that Photovoice is all about shared knowledge and shared co-construction. And so you have to let go of that power straight away, and which is often hard for researchers, right? Because we feel that we know everything. And so what I did was, like I said, I worked with the community staff members first. They were all community workers, and 3 of them stayed on with the project all the time. So they really communicated with each other. They got to know everybody. They knew exactly what I was doing before I was doing it. They were my translators. So they were really my research team. And then I had 2 youth in the community that I recruited to help me with the audiovisual, because there was a lot of videos and cameras and audio recorders and everything, and I couldn't keep track of it all. So I was already building capacity within the community while I was doing this. So I was not the researcher. We had a research team. Anybody could take the cameras, anybody could take the audio recorders, and anybody, included the children. From the beginning, they had to learn to be comfortable with it. If they felt there was something important, they took photos of it, and that was outside of the Photovoice. So it was very early in the process that I kept enhancing and emphasizing it's our study. We are capturing what is important for us, and that was consistent, so that by the time we did the Photovoice, which was probably on my 3rd visit there, I was still a white educated researcher, psychologist coming in, but my Sesotho was a lot better. We knew each other, we were sharing personal things. Everything the children did, I also did. Everything they shared, I shared. So it was very much about that. And I think that's how the positionality came, is that I grew and I learned just as much about myself as I did about the community I was in. And that also helped the sustainability and the impact, you know, for those people who are going in not only to do the research and the theoretical part, but really wanting the impact, wanting the transformation, so that when you leave that, your work continues and has a life on its own. And of course, by the time you get to the end and the dissemination, which we're going to chat about now, I said very little, because by that stage, I was almost invisible. I was cleaning pots in the kitchen, you know, and it was their big day, not mine. So we kind of shared in that space. Yeah, and I think it was really more about, my focus was that I'm coming as an outsider. So I had two values coming in, be generous and be authentic. And whenever challenges hit, which they do in community based research, things never go as planned. You anticipate that things are not going to go as you want them to be. So when those challenges and obstacles came, those were my go-to things. How do I respond? By being authentic and by being generous. What would be the right thing to do here? And that's what really guided me in the difficult situations. Yeah.
Excellent. Thank you, Dr. David. Thank you, Dr. Avi, for reflecting a bit on your position as a researcher. And I loved hearing about the field journal, or the journaling during data collection and analysis. That's something that's so important in qualitative work generally, but also in Photovoice as we think about our own biases, but also what we're observing and how that may be valuable in the future, you know, summaries or write-ups or dissemination. So thank you both so much for that. Our final question, and then we will enter into about 35 minutes of Q&A from the audience. We have some amazing questions that have come in. You can keep them coming, and if we're unable to answer them today, they will come to you through email to everyone who's registered. But join me in thanking our guests thus far as we move into our final question as a panel, and then into your questions. So the final question I think Avi alluded to, which is about dissemination and the sharing of the findings. And we had in our first webinar in September, we talked a bit about community-based participatory research as well in a different way. But we keep highlighting in all of these webinars the movement from research findings to practice, and how important that is, and how much we have to step into that space. And so I'm wondering if you can tell us a little bit about one example of how you disseminated the findings or the recommendations or whatever that work was, and how that resulted in change or new actions or new solutions. And that can be, you know, anywhere in the process. It can be unfinished, but we'd love to hear from you. And we'll start with David and then Avi.
Thank you very much, Zahira. So again, there's a lot I can share regarding dissemination, but I just want to point out how this Photovoice study was able to facilitate change in the community. But before I go into the actual change, I just wish to emphasize that for our Photovoice studies, we ensure that after the photography is all done, we involve the participants themselves to select the key photographs they believe are most pertinent and appropriate to them and their communities. So after the photographs have been selected by them, they actually go ahead and present them to their communities. So in this photograph, for example, one of our participants was disseminating photographs that were printed on a board to community members. So we really emphasize participation along the way, including dissemination, for them to really take a lead in having these photographs presented and discussed. One thing I want to share with the audience, that the mere fact that these photographs were from the community and taken by community members and disseminated by them, the community members really appreciated the issues that emerged from the studies, probably much more than any other, research could do. And I've been involved in other qualitative and quantitative methodologies, with very nice statistics and chi-squares and all kinds of, regressions and so on. But in terms of community uptake of findings, I wouldn't see any method that can really bring out the key issues that relate to them than Photovoice did. And this was really, really important. But more importantly, seeing the community members themselves discussing and talking about them, and not me, the researcher, which for me was important. But just to give an example of how a photograph really was able to lead to change. So one of the photographs that came out from our initial study was that there was a lot of teenage pregnancies in the community. In this photograph, for example, this was displayed in the community dissemination, and this was a photograph of a teenage girl who was pregnant, but she already had a child who you can see was probably 1 to 2 years old. So really the community members were surprised, but they really appreciated the concern given that was coming out from this particular study, and that they actually saw a photograph of a young girl who they knew who was actually expecting at that early age and already having a child. So with this finding, one thing the community members agreed upon there and then, that they needed to do something to really change the status quo and see how they can support the community in terms of preventing teenage pregnancies to continue occurring. So actually the community themselves teamed up with an NGO that was doing work in reproductive and maternal health, which came to the communities and sensitized boys and girls in the community, but also in schools in terms of preventing and avoiding teenage pregnancies. And one thing that was surprising was that we as researchers, we had no role whatsoever in this action. It was the community themselves who identified a partner who actually came in and carried out a number of sessions within the community. And we actually found out later on that these sessions was really instrumental in creating awareness and supporting community members, especially the youth, the young boys and the young girls, in terms of preventing unwanted pregnancies. So that is really a typical example of how these photographs are that powerful to really lead to change in the community.
Excellent. Thank you so much, David, for highlighting your community dissemination process. Avi, on the same topic.
Right, so as I mentioned before, the study I did had sort of a two-prong approach, and the one was the theoretical, and that was really me taking the data that was generated in a very academic way, doing my analysis, thematic analysis, and recontextualizing with the literature. And then for my doctoral thesis, I presented a framework, which I did share then with the community, but they weren't really much interested in that. The second aspect, the second aim of the study was the development part, and that was really the role of the community to forward that. And we started off right in the beginning by saying that whatever I'm generating, is our knowledge. And so they had to make a decision of using or disseminating the knowledge as well. And of course, it was a big community day where everybody was invited. The other beneficiaries or children of the community center were invited, the families, extended families, the chief social workers, some of the principals, some of the teachers. So any of the VIPs in the community. So it was quite a big day. And they ran the whole thing. I just sat there and took some photos. I said a little hello speech and I think a motivation something, but the kids ran the whole thing. We printed t-shirts, which they designed. They were called Hope Champions. They did a drama. So they basically had to present back what they had learned about their own hope, what they had learned that makes them hopeful. And basically it was, they did a drama. They wrote poems, really to teach the other children, and to uplift everybody. All the visual stuff we had done, the Photovoice posters, the collages, everything was up on the wall. And then the Hope Champions took everyone around the exhibition. So they took their own family members, they took the principals, and it was really quite amazing to see them engage and the adults were sort of asking questions about things. And of course, you can imagine now family members seeing images of rape and violence, but also seeing the amazing things. And a lot of the images in terms of what gives you hope was your family and what was your teachers. So that was really quite emotional for the adults to walk around and see things, see how the children were experiencing everything was quite amazing. The change that happened, obviously, from that day, I met afterwards several times with the staff of the center and the board, and we did design a program together based on this information, based on the methods I'd used that the center was then able to implement, and we were able to fund through the organization that I was with. So there was definitely practical applications, but in terms of real impact and real change, for me, it was look, the children worked with hope. So I was kind of expecting the direct thing, you know, these children were becoming more hopeful and confident and all of that I was seeing. But the amazing thing that I hadn't realized was the change that was happening in the adults who were working with me. It was absolutely amazing. And we're talking about unemployed adults in the community. Some were youth, most of them had not finished their high school. So the confidence levels were not great, right? And seeing how the children responded and seeing how hopeful the children were, I actually had such a turnover with the staff members, because halfway through my study, 2 of them decided they wanted to continue with their high school education. They were motivated to continue the studies. One person got employed. He actually applied for a full-time job. They only get stipends here. He applied for a full-time job at another community-based organization, quite a well-known one. He got the job. Another one took on, he decided to sign up for a diploma in project management. And so while I was excited for them, because here's these adults thinking, if these kids can do it, we can do this. I was losing, you know, assistance right, left and center. So that kind of change was amazing. And of course, the well-being in the community was phenomenal, because one of the big, like one of the stories, if I may share, was, remember when we started, the staff had to choose the participants, and they said they chose these children because they're vulnerable and they desperately needed hope. They were not happy, they were not doing well. You know, and by the end of it, they really embraced this idea of hope champions, and the children became role models, they became peer mentors. And even the family members said, wow, I didn't know my child had so much hope. I didn't know my child was that clever. He knows how to use a camera. I didn't know my child could do this. You know, my child was so quiet, and now look at her. She's standing up there reciting poems in English. You know, it was just amazing to see how the adults were now seeing the children differently. You know, and the children started getting more responsibilities because now they were trustworthy, they were responsible, they, you know, and they became leaders, and they were then recruited into the program to be peer mentors for the others. So a lot of that, where I was focused more in terms of observing the change in the children, it was right at the end that I really realized how much had actually changed in the community itself. Even the teachers and the principal that come to see this, subsequent visits, we had conversations, and they were saying to me, they're starting to implement this in the school. You know, that like the whole mind shift had moved away to, we're not rural, disadvantaged, impoverished, vulnerable, deficit. We actually have so much that we could embrace in this community. So that was really amazing.
Excellent, excellent. Thank you so much, Avi. Thank you so much, David. We're entering our Q&A now. So thank you to everyone who has stayed on and is enjoying the experience of learning from these 2 researchers. I'm going to move through some questions, the really good ones that have come in. But as I said, if they don't get answered today, they'll come to you by email. Also, feel free to give us feedback in the Q&A on what you've heard today, or if you've participated in the first webinar session. That's always welcome as we think about the future ones in 2021. So David, Avi, thank you so much. We're going to move into some questions for you, and I'm going to give you 2, one for each person, and then you can unmute and share. So I'm just looking at my phone where all the questions have come in. And so the first one for David, this person says, thank you for sharing about your project regarding maternal health. Was there a particular aspect of maternal health that you were focusing on? And you can hold on for that question. And Avi, the question that came for you was, how does the benefit of using Photovoice compare to observational studies? So I'll give you both a moment to think about those responses, and then we will start with Avi, and then we'll follow with David. Our first 2 questions.
Okay, thanks. Thanks for that question. I think, you know, observational studies, I think it's that power capacity building aspect, because observational studies, from my understanding, I've never done them, but that's the ethnography, where you're observing an experience, you're observing other people's world, but you're still interpreting from your worldview. Whereas Photovoice is not that at all. All I did was bring the cameras and give the prompts, and I facilitate. That's all I do. My knowledge only came right at the end. My analysis only came in theoretical analysis. those pictures do not represent my understanding of anything. They represent the children's world. They plan the photographs, they write about them, they structure the stories, they think about them, then they get the cameras and they take a photograph which has already been thought out. It's not like they go with a camera and they just, you know, they've structured and planned and organized this. They know exactly what they're wanting to share in a photograph. And then they talk about the photograph collectively. Then they show you this is this and this, and you ask questions. They ask each other questions. Afterwards, you come back to that. So it becomes a prompt for a lot of the conversations. And like I said, then they do the analysis. So when everyone's shared, then I can say, right, I'm there with a clipboard or the flip chart, and we say, these are kind of the words that I picked up. So every time they present, and then we have little colored stickers. Which one are the most important to you? You know, do you think this and this is the same, or which two are the same? And they come back. So for me, that is the huge difference, is that in observational studies, there's not as much of the participation and the capacity building and the ownership. You're kind of observing someone else's life world, whereas I was in that life world. I was right in the middle of it, trying to, facilitate and capture. But those kids had no problem in saying, no, Doc, that's not right. You're not understanding me. Let me explain again. They very much want to be heard and understood and clarified, regardless of the culture or the language or the age. It becomes something that is so personal to you that you want to make sure that you've represented yourself authentically.
Excellent. Thank you so much. David.
Thank you so much. So in terms of the focus on maternal health, so as I hinted earlier, we didn't, at the start, as we were writing the proposal, we didn't necessarily know how youth would be able to contribute anyway to maternal health. So even during the actual introduction of the project to the participants, we weren't very prescriptive to really, make them appear like we are really asking them exactly what we wanted. We really left the maternal health in the broader context. But what I should emphasize is that during the training of participants, as we talked about the theme of the interest of the study, we talked about in the broader context what they think would need to be done in terms of before a woman conceives, during pregnancy, during that period of childbirth, and after childbirth. And we really didn't go into the details in terms of what we expected of them or not, but we just introduced those broader categories of areas, and it was up to them thereafter to dig in and see in what way the youth individually could contribute towards each of those aspects. But just to emphasize that given our public health background, we also again expect that their role would really be in that line of public health and health promotion, as opposed to anything beyond that. And indeed, the photographs came through looking at how they could contribute towards the public health component of health in general, and how they could individually contribute towards maternal health in that way.
Excellent. Thank you all so much for those two questions and jumping in. I have two more for you coming from this really engaged audience. So thank you all for the questions thus far. The next one is for Avi. What adaptations would you advise to make a Photovoice study a longitudinal study, say over a 5-month period of a series of photographs? So that's for Avi. And then for David, this person says, I'm really interested in how, as a researcher, you manage your own responses to the photographs. I recently started a 3-year project working with people at the end of life using Photovoice, and I'm interested to know your approaches to debriefing, to psychological support, and otherwise. So I'll give you both a moment to craft your responses to that. And in the meantime, just want to say thanks for the questions thus far, and also feel free to put comments, suggestions, feedback in the Q&A that we'll take into account as we move into 2021 and our third episode. So I think I'll hand over to Avi and then David.
Okay, that's a really great question. And I think with the time that we've had, our focus more in terms of the research aspect, but I've also used Photovoice in terms of my community development work. And especially, it's a beautiful, beautiful tool to use when you want to capture significant change. for funders, right? And often you're capturing statistics, but statistics don't speak as beautiful as an image does. And so Photovoice is a lovely tool to be able to do your needs analysis. So starting right off with the community, what are the actual needs? What are the issues? What you know, I can come in and I can say, I think you need maternal health or hope or whatever, but that's me coming in. What do you want? What do you need? What are your issues? You know, and really get to understand things. So I would say in a longitudinal, you start there. You start with really just a very general Photovoice prompt in terms of just show me your lived reality, show me your experience. What is it like to be a 12-year-old girl living in this rural village? What is it like to get to school? What are some of the things that challenge you? What are some of the things that build you? You know, what are the good things, the bad things? And then you use it right at the end, you know, so you start with the needs analysis, you use it at the end. What has changed for you? You know, show me how this program has influenced or shaped what is different for you now, you know? And again, it's capturing a person's moment, experience, life journey. The other thing is that Photovoice is not a once-off thing. So it's not, you know, research is not linear. It doesn't mean you've taken the picture, now we leave it. We can go back to it over and over and over again. Data is data, it doesn't disappear. We can, you know, if you wanna share something, you wanna change something, you know, sometimes I had a year and a half. So when we came back to the community day, some of the kids wanted to redo some of the pictures because things had changed for them. And that's awesome because they should be able to do that. You don't want to say, oh no, don't touch it, that's data. Nonsense, right? So recreate what you wanted to recreate and now put them next to each other and then talk to them. It's living, data lives because a person's reality and experiences is a lived reality. It changes and it morphs, and so should your engagement, and so should the data. So I think for me, it's being creative in terms of the Photovoice. In essence, is a method of using the visual, the cameras, to capture a moment, but then using that visual as a catalyst to talk about it, to explain, to think about it, and to really engage with it in multiple ways. You can do posters like I did, which is just one picture with a caption. You could ask them to narrate a story. They could put several pictures. They could do mind maps. They could do collages. They could do so much with those images. They could do a before and after, you know. So there are so many creative ways that have already been used with Photovoice and that you could come up with.
Excellent, thank you. Over to David.
Thank you, Zahira. So that is a very important and interesting question in terms of, again, positionality. You know, what is my role as a researcher in the whole process, the photographs taken, and so on. One thing I wish to emphasize is that one thing we made clear from the start was that our main role in the research process, if you like, really had a strong emphasis to the point of the training. So during the training, we were able to tell them what we had in mind as the broader interest in terms of maternal health. And it is at that point that we really brought in what we felt were the stages in which they could consider taking photographs on in their communities concerning how they could support maternal health. But during the monthly meetings, we really made it clear that our role was simply to see what they had done, listen in to them, but also, you know, guide the discussion in terms of if they're getting, you know, off astray or off the point, or if there's any conflicting issues emerging. But we didn't at any one point really, you know, dictate or even make our own, you know, perspectives or views on the photograph. So really we made sure that we kept at the back of it and were only, you know, passengers, if you like, just, you know, listening in and supporting and you know, offering guidance here and there. But also in the other stages of, for example, selecting photographs for dissemination and so on, we still made sure that we took a back step and let the participants take the center stage in terms of selecting photographs, in terms of having them talked about, in terms of, you know, we even involve the participants in other forms of dissemination, even beyond the community. So really, I think it's upon the researchers using Photovoice to appreciate from the start that although you're the researcher, you may be the principal investigator, this methodology really tries to empower the participants and let power be more in their hands than anyone else. and then you as a researcher play a role of guiding and playing second fiddle, if you like.
Excellent, excellent. I hope everyone who's logged in and listening in is enjoying this part of the Q&A. We have just about 15 minutes left in the Q&A portion. And as I said, you'll get an email with the answers to questions we don't get to cover. But I have two more for our guests. One is for Dr. Avi. And this person says, Avi, it's evident that your research affected you deeply. How did you debrief, and what was your most important discovery about yourself, if you are comfortable sharing? For Dr. David, this person says, or maybe this is for both of you actually, assuming you have generated traditional outputs from your projects, like academic publications and other things, could you please discuss that process, particularly with respect to identifying or agreeing on the project's purpose and the expectations regarding writing? So 2 questions, and actually either of you can answer either of them. So a question on how the work changed you, and a question on how you navigate these traditional academic outputs with other kinds of work. And I'll hand to David and then Avi.
Thank you so much, Zahira, but also thank you, the participant who has asked that question. So just to emphasize that as academics doing research, certainly there are always research outputs that come very quickly to our minds. So publication certainly is one of those. And I must say that we indeed, and we are still continuing the publishing from our Photovoice studies. But looking at Photovoice as a methodology, I wouldn't say that publication should really be the primary output from our research. And although we have a few publications from our work, we don't really see this as the aim of the methodology. And you sometimes do other studies whereby the sole purpose is for you to have a paper out of the work, which we've also done in other instances. But for me and my research team, our interest has always been to really follow through in terms of how Photovoice can actually benefit the community directly. And this includes things such as capacity building and capacity enhancement, as we heard from Avi earlier. But more importantly, how the photographs taken themselves can help and lead to change in one or another in the community. So for us, before we even thought of writing up papers from our work, we had to make sure that indeed the primary dissemination of the community engagement and community meetings took place. And we followed through to ensure that indeed some emerging benefits were seen. And in fact, our dissemination engagements were normally a month or 2 after the photography period, just again to ensure that the momentum continues and that we really have the community's benefit. The publications and other dissemination of conferences and seminars sometimes came, a year or 2 later. We're even writing, some of the work of, work done earlier. So yes, scientific outputs, but that is secondary. The primary output is how the Photovoice study can assist and inform the respective communities.
Excellent, to Avi.
Right, so yeah, the debriefing was quite a process. As I said, I did have to supervise to debrief, but also I was authentic and genuine with the people in the community, and sometimes I needed to debrief with them. They were also influenced by some of the things that were happening. I was very aware that I'm coming in and out of a community, then I leave, then I come back a few weeks or months or whatever later, and things have changed. So we kind of also bounced off one another, and it wasn't like I was coming in and I'm the trained psychologist and you must listen to me. Sometimes I had to cry on their shoulders or get frustrated and kick something, and that was fine. And I think that was part of our journey together, is to see that we're all human and to kind of transcend the boundaries and the segregation that we had lived through, to kind of find a middle ground of being together and really connect with. And what I learned about myself, I think the one key personal thing, there were many, but the one key personal thing was that I've always resonated a lot more with this collectivist oriented worldview. It always resonated a lot more to me than the individualistic one that I was raised with and that I was trained in. And then coming as a psychologist with all these Eurocentric ways of doing things just didn't work with me. And then being in this community and really understanding and learning so much, I really learned my own worldview, and I really learned to position myself better and be comfortable with who I am in the world and how I want to be in the world, and fight for what I think is right. So that was key. And one of those things was, I was really uptight and trying to control things, and everything has to be like this, and this is in the box, and don't mix the colors. And you can't do that in community work. And it was this huge process of letting go and just, it's spoiled, doesn't matter, it's broken, whatever, it's fine, you know. And letting go of not sweating the small stuff meant that I could really, really focus on meaningful things. And that again came with the outputs. And yes, you know, I think this is one of the hardest thing for me in balancing the two things, was that the academic world is so far behind the realities of what is happening. You know, the way we are told by universities to do research just doesn't work. Ethics is just, actually, it's unethical to follow the Belmont Report in some ways. You know, ethics are communicated in such completely different ways when we engage in the real world. And it's so hard to try and be, and I'm going to say, in the real world with real people experiencing real things, and now have to go into university or into funders and live in that world, which just does not make sense anymore. And that was really hard. And what I did in terms of the publications, yes, I published a lot, and I will give you all the links to all of that so that you could read all the details, you know, of the process and all of that. Yes, and I walked across the stage and got my doctor title and my thesis and books and all of that. But it was always arranged with the community that I'm not the only one who's spreading the news about this, because you guys have invested 1.5 years of your lives too. So what are you going to do about it? And remember, they didn't really care much about academic articles and a thesis. What they cared about was funding. And so what we worked, they would, you know, come up with plans and proposals for programs, and I would help them generate that into funding proposals that was more meaningful to them. Plus, there was a lot of community dissemination. The chief, of course, was besides himself with excitement, and he wanted to get a whole lot of publicity around what was going on, which, you know, we were helped, because it wasn't, again, my data, those images, everything stayed there. It belonged to the center, it belonged to the community, not to me. They could work with it in any way they wanted to work with it. They did radio interviews, you know, they reported to funders using this, which obviously meant they got more money. So they had their own benefits, and that's what that was negotiated from the beginning. It wasn't at the end to say, okay, well, I've got a thesis, what do you have? That was always negotiated throughout. I was also very mindful of not appropriating traditional knowledge as academic knowledge, right? Because that is huge in terms of, now we take indigenous knowledge systems and we now make it our own. That was never the case. And so if you read through my work, consent, permission, negotiated, renegotiated often. A big thing for me was, in terms of publishing, I wanted the faces of the children, because the children themselves consented. They wanted ownership. It is them. They don't want their faces blurred. They wanted acknowledgement of it. The Senkizito Children's Center wanted to be acknowledged as the research center that did this. You know, the children were all given things to consent to, but then I also went to the families. But then we said the families were not literate. They maybe didn't understand. So we went to what we called leaders in the community. We went to the principal, we went to the chief, we went, you know, so we highlighted leaders in the community who would, for the academic, you know, tick boxing, would have the insight to understand consequences, to understand, if I took a picture of Zahira enacting violence, would any harm come to her? What would be the long-term effects? You know, all of that kind of thing. So we had a focus group with the community leaders talking this through. And if they were comfortable, they signed a consent form to say that they would like, they've consented this on behalf of the families and the children and the community, that they would like to waive anonymity. So it is a process, but hopefully with more of these webinars and with more students engaging with these kinds of research ways with communities, we can break those barriers, and we can stop being the university and the community, and we could be a community of knowledge creation.
Excellently said, Avi and David. Thank you both so much for engaging in this remarkable Q&A. The level of participation from the audience, I appreciate. We haven't gotten to all the questions, but we will through an email to you and with the recording of this material. I have one final question for you all before we start to wrap up a little bit and think about how to transition this conversation into future conversations. But if you remember, for everyone on the call, that the title of this conversation is really around advocacy, it's around research, it's around activism, and particularly around this concept of storytelling. And so I'd love for our panelists in their final response to reflect with us a little bit on storytelling and its power in research, and essentially help us understand a little bit about why storytelling is important to you, what you think it does in this work, and what power it brings to the conversation of research, activism, and advocacy. So a little bit on the power of storytelling, and I'll give you a moment for that. And while we wait, thank you everyone for your participation in the chat. A few housekeeping things before our final response, but as I said, you'll get a recording, you will get the materials. Dr. Avi alluded to some publications. You'll get a whole host of publications that do different things. Some will help you read and understand, some will give examples of all of their work, but we're really excited to expand all of our efforts in this space on Photovoice. So final questions to David and Avi, maybe starting with David, ending with Avi.
Thank you very much, Zahira. And as somebody who had participated in other research methodologies before I used Photovoice, I certainly can tell you indeed the power of storytelling and having photographs as a tool to facilitate such discussions. So for starters, the mere fact that photographs have been taken by the community members themselves is a key component of Photovoice, given that it is really the participants who are showing you what has transpired and what exists within the environment. But more importantly, if you put the photographs aside, it is the discussion and the storytelling and the interaction that actually follows through the photographs. Sometimes people wonder, is it just about the photographs? And I say it's not just about the photographs. It's probably more to do with how the photographs facilitate the discussion and engagement and interaction. And one thing that actually was interesting from this particular study was that although a photograph may have been taken by one participant who could talk about it in a certain way regarding how they thought it related to the theme, after they talked about it, another participant could come up and say, oh, well, that's what you see, but for me, I see something different, but again, in line with the theme of the study. So again, having such engagements and having the group discussion of being able to learn from each other, share experiences, share perspectives, looking at things in different angles is very, very important. And I must say that I wouldn't see any other method that can really bring out such richness in terms of community issues and how they can be looked at from different angles and perspectives and so on. And one question sometimes I am asked was that, does the quality of the photographs matter at all? Because again, somebody may not have had a very good quality photograph. And my answer is that for me, the quality of photograph is secondary. What is primary is the message and what is able to be discussed and the stories that are told around the photographs. If the photographs come out very clearly, well and good, but if not, at least let's not miss on the discussions around the issue of concern. And that's why, just ending on this, what we did in our Photovoice study was that in addition to giving participants cameras, we gave them notebooks to be able to document any scenario in the community that was worth capturing on camera, but they could not for any reason. For example, if they didn't have the camera with them, or they didn't have permission to take the photograph, they still took note of the issue of concern, and that issue noted in the notebook was still used to facilitate discussion. So this again emphasizes the storytelling and the discussion and the, being able to discuss as a group and raise the issues of concern that really affect them, which again facilitates the outputs that we've discussed in detail earlier.
Excellent. Thank you so much. We have just about 4 minutes. Avi, on storytelling.
Gosh, Zahira, I think we need a whole webinar just on the power of storytelling to squeeze it into 4 minutes. I'm biased because as a psychologist, that's what I do. Human beings are stories. That's what excites me about psychology. Is it's not behavior, it's a story that drives your behavior, what drives your motivation, what drives those emotions. Everyone has a story, that's the thing. We're all different, we're all the same. Everyone has a story. What we don't, unfortunately, as a society anymore is listen. And when you give people an opportunity to tell their story, I promise you, it comes ducting out there, it comes pouring, because we all have stories. And how do we, stories are essential to every culture, every community, every existence. We have stories. That's what we remember. We teach through stories. We learn through stories. You don't learn from textbooks. You want to teach a child about don't go to the river, you tell them a story about a monster in the river. You want to connect with a loved one that's that's passed on, you tell a story about that person. Our whole lives are interconnected stories. So to me, that's the power of a story. If you genuinely, as a researcher, want to understand, if you want to understand what is happening in a community, what could be happening in a community, if you want to understand what is troubling a community, but also what do they hope for, what do they desire, what do they want to see, what is their vision, what is their future, those are all stories, the stories we create, and so I think that's the power of storytelling. Now you put a visual with a story and bang, you can have hours and hours and hours of engaging with a person on such a human level, because now you're not just hearing their deep soul telling you a story, but now you're seeing something. And as human beings, we connect that way. And I think that the other important thing I want to say about stories is that we all think, stigma is one of the biggest things in the world. There are so many mental health issues, physical issues, problems globally because of stigma and discrimination. And you just have to open a window to say, I'm experiencing this, but I'm not the only one. We're all going through this. Or I didn't realize. Now sharing my experience makes the load less, or more bearable or less heavy. And I think we take that for granted when we're so concerned about people's privacy, which I'm not saying we shouldn't be, but sometimes, sharing our stories in groups is so much more healing and so much more powerful than isolating people and just taking their stories and not having it validated within their community, within their family. There's nothing more rewarding than being understood as a human being. And I think that's what stories and images do, just to be understood and to be heard and to be visible again is really, really important.
Excellent. Well, thank you all so much. In our final moment, please join me in thanking Dr. Avi and Dr. David for their contribution to this amazing conversation on Photovoice and storytelling. I think we have many things to move away with around the power of imagery. A lot of the reason that we are doing this as the Department of Community Health and Social Medicine is because we feel like in 2020 and beyond, we have this moment to dismantle many of the power structures that make research unfair and unequal, many of the power structures that make what people need and desire and demand unheard. And so we're looking at Photovoice as just one way that we help and support communities in being heard and shifting to the solutions that they deem most appropriate. And one of the things I think we want to end on is this act of listening. And so that researchers and others, policymakers and practitioners, that we have this opportunity to pause, to not dominate, and to radically listen to communities in order to solve problems in ways that are sustainable. And so I am so grateful to Avi, to David, and to you for joining us. Murakoze chane, asanteni sana, shukran, wherever you are in the world. Thank you, thank you, thank you, and have a great evening. Thanks so much, everyone. Bye-bye.
Thank you, bye-bye.
Thank you, everyone. Bye.